a neuroscientist at Northwestern University, did something nobody had done before. He took 39 people with new back pain less than 4 months old, and put them in a brain scanner. He didn't scan their backs, he didn't look at their discs, he scanned their brains. And from those brain scans alone, he predicted with 85% accuracy who would still be in pain a year later. 85% from a brain scan of people whose backs looked on imaging completely normal. If you've ever been told your scan looks fine but your pain is real, this episode is for you. Today I want to take you behind the door of my treatment room into the actual session so you can see what chronic pain really is and what we actually do about it. This is going to change how you think about pain. Welcome to the Wellness Bridge. I'm Gary Chen, physiotherapist and founder of GC Integrative Physiotherapy and Wellness on the Gold Coast. This is the show where we bridge modern movement science with the wisdom of ancient healing traditions, because true health doesn't sit on one side of the world. When somebody walks into my room with chronic pain that has lasted longer than 3 months, there is something I almost always know before they even sit down. The problem they came in for is not the problem we will treat. Let me explain. The Lancet in 2018 published a major series on low back pain. The biggest finding from that series, and from hundreds of trials since, is this: 90% of low back pain has no identifiable specific cause. The disc bulges, the degeneration, the little arthritic changes, those same findings show up in people with no pain at all. That means a scan can tell you what your back looks like, but it cannot tell you why it hurts. So if it's not the back, what is it? In 2022, a research team at the University of Colorado did something extraordinary. They took 151 people with chronic back pain, people who had been suffering for years, and gave them a 4-week program called Pain Reprocessing Therapy. 8 sessions, no surgery, no injections, no new medication, just a structured way of teaching the brain that the pain it's producing is a false alarm. At the end of 4 weeks, 66% of those patients were pain-free or close to pain-free, compared to 20% in the placebo group and 10% in the usual care group. 1 year later, the effect was still there. That study was published in JAMA Psychiatry. It is one of the most important pain studies of the decade. 66% pain-free in 4 weeks by changing the brain, not the back. So here's what I do in the first session. The patient comes in, maybe they're holding their lower back, maybe they're walking carefully. They sit down across from me, and the first thing I do is something most people don't expect. I don't reach for the bed. I don't ask them to undress. I ask them to tell me their story. Not the medical story, not the imaging story, the story of when this pain started, what was happening in their life, what they are afraid of, what they've stopped doing. Because chronic pain is rarely just a body event. It's a body event that happened in a particular life at a particular time, and the brain has learned something from it. Joseph Vlayen, a Belgian researcher, described this loop back in 2000. He called it the fear avoidance model. It goes like this: you hurt your back, you catastrophize. You think this is serious, this is dangerous, this might be permanent. You become afraid to move. You avoid bending, lifting, walking far. Your body deconditions. Your brain, watching all this, decides, yes, this is dangerous. Let's keep the alarm on. And the pain becomes chronic. Notice, the original injury might have healed weeks ago. The loop is now the disease. So in my first session, I'm not testing tissue. I'm listening for the loop. I'm listening for the words I'm scared to. I can't anymore. The doctor said my disc is bulging. I might end up in a wheelchair. Every one of those phrases is a door that the brain has closed. And every one of them is something we can reopen. This is the part of the session that surprises people the most. After I've listened, after I've done a few simple movement tests, I say something like, your back is not damaged. Your nervous system is being protective. We're going to teach it that you're safe. And here is where Western pain neuroscience and Eastern wisdom say almost the same thing in different languages. In traditional Chinese medicine, there's an idea called qi stagnation. When the flow of vital energy gets blocked, pain follows. The treatment is never to fight the blockage. The treatment is to restore flow through breath, through movement, through softening the body. In the Tao Te Ching chapter 78, Lao Tzu writes, nothing in the world is softer than water, yet nothing is better at overcoming the hard and strong. He's not talking about plumbing. He's talking about the inner posture of healing. Resistance hardens. Yielding softens. Modern pain neuroscience says exactly this. When you brace against pain, clench your jaw, hold your breath, fight it. The brain reads that as more threat, and the alarm gets louder. When you breathe through it, soften around it, observe it without alarm, the brain begins to update. The threat appraisal changes. The pain decreases. The Western language's fMRI scans of the anterior insula and the anterior midcingulate cortex calming down. The Eastern language is qi flowing again. Different lenses, same phenomenon. So if you're listening to this and you've been living with chronic pain, 3 months, 3 years, 30 years, here are the 5 things I want you to take from today's session. 1. Pain does not equal damage. Chronic pain is your brain's threat alarm, not a real-time report of tissue injury. The Mansour study from 2013 showed that brain structure predicts chronic pain better than the back itself. This isn't in your imagination, it's in your nervous system. 2. The body adapts to what you avoid. The Cochrane Review of Physical Activity and Chronic Pain, 21 reviews, hundreds of trials, found that movement reduces pain, not aggravates it. Movement that feels safe is medicine. The type of movement matters less than the safety the brain feels while doing it. 3. Breath comes before movement. 5 minutes of slow breathing before you stretch, before you walk, before you lift, calms the alarm system enough that movement registers as safe. This is the bridge between the autonomic nervous system and the motor system. 4. Words matter. The phrase, I have a bulging disc, creates more pain than my body is being protective. The phrase, I'll never bend again, creates more pain than I'm relearning how to bend. The brain listens to your story about your body. Tell a different story. 5. Get assessed by someone trained in pain neuroscience. Not every physiotherapist works this way. The Australian Restore trial published in the Lancet in 2023 showed that a 7-session integrated approach, combining education, cognitive work, and graded movement, saved patients an average of 5,000 Australian dollars in healthcare costs at 1 year, compared to usual care. So this is not just a quality difference, it's a cost difference. Ask your physiotherapist if they practice pain neuroscience education before you book. In 2021, the National Institute for Health and Care Excellence in the United Kingdom, NICE, released new guidelines for chronic primary pain. They recommended against paracetamol, against opioids, against gabapentinoids. They recommended exercise programs, psychological therapies, and in some cases, acupuncture. That is the most decisive regulatory rejection of pharmacological first chronic pain care that any major health body has ever made. What this tells us, what the JAMA study tells us, what the Lancet tells us, what the Cochrane reviews tell us, is that the future of chronic pain care is integrative. It is movement, it is education, it is mind-body practice. It is the slow, patient work of teaching a frightened nervous system that it is safe. If you came into my treatment room today, that is what we would do. We will talk first. We will breathe. We will move gently. We will change the words. And we will do it knowing that pain is not the enemy. Pain is a messenger that has lost its way home. And our job is to help it find the path. Thank you for spending this time with me. If today's episode helped you see your pain differently, share it with someone who needs to hear it. Save this episode and come back to it. The brain learns through repetition, and so does hope. Until next time, take care of your body, listen to your nervous system, and remember, together we find balance in one.